January is Thyroid Awareness Month, a time set aside each year to raise awareness about thyroid disease and the millions of Americans it affects. According to the American Thyroid Association, an estimated 20 million Americans have some form of thyroid disease. Up to 60% of those with thyroid disease are unaware of their condition. The thyroid is a butterfly-shaped gland located in the front of the neck. Its job is to produce hormones, which regulate our body's metabolism, and it affects critical body functions like our energy level and heart rate. Dr. Judith Milstead of Lake, Ear, Nose, Throat and Facial Plastic Surgery explains how this tiny butterfly gland has such an effect on our health.
The thyroid is an endocrine gland that controls the metabolism among other things, and it is sort of the generator of the body's rate of metabolism. I think everybody that comes to my office is sluggish. I haven't seen anybody that says I have enough energy and I'm feeling great, you know. But those are kind of issues that I tend to let the the endocrinologist follow, or the family physician. I'm more of a surgical approach. You know, the thyroid's too big, it's cutting off my wind, I can't move my neck, I can't swallow, things like that. Usually an endocrinologist will tell them when they have thyroid problems. Now, what I usually see are thyroid nodules, or something you can palpate, something you can touch, something you can see on an x-ray, things like that. That's more of a surgical thyroid problem. Endocrinologists refer them, the family doctors refer, and cancer doctors. I get a lot of referrals from cancer doctors when they see something on the PET scan that they can't explain. There's several different kinds of thyroid cancer. The most common is something called papillary carcinoma of the thyroid, and that's usually picked up as a nodule, or the patient can feel it as a firm area on their neck. And that's treated with surgery primarily. Now, if the cancer is showing signs of aggression, like growing outside of the thyroid gland itself or growing into the vessels around the thyroid, then we follow up with radioactive iodine, and that's given by the radiation oncologist. Also, if we know there's a big cancer in the neck that's come from the thyroid gland, we'll incorporate a bigger surgery to remove some of the glands around it. I see them in just about everybody, 20-year-olds to 90-year-olds. They can have thyroid nodules, or be hyperthyroid, or have other kind of thyroid problems. If they're going to have surgery, they want to know when they can resume all activities, try to get them back as soon as they can. Want to play golf, or how do I pick up my golf ball? And we get around that. We'll find a way.
For more information on this story, as well as links to the specialists at Lake, Ear, Nose, Throat and Facial Plastic Surgery, please click on the Thyroid Facts story link on our homepage at yourhometownhealth.com.